Hello students, I hope that you have already undergone the previous two videos on myopathy. So in this presentation, I am going to discuss about the physiotherapy management of myopathy. Physical therapy in case of myopathy is divided into two aims or goals. One is preventive therapy and the other is supportive therapy. Okay, so prevention of complication and support to the patient is forms a goal of physiotherapy management. Now, as we know, the commonest type of myopathy that we come across is Duchenne's muscular dystrophy, that is DMD, and it affects the small child. It starts with an age of 3 to 5 years and it progresses till 15 years, and the child may not live beyond 20 or second decade of life. Okay, so, since it affects the child, you need to keep in mind that whatever physiotherapy program you design should involve lot of activities that is playful. Okay, playful activities. Other thing to bear in mind is that since most of the myopathies are progressive, with physiotherapy, we cannot halt the progression of the disease, neither can we slow down. Okay, but the aim of physical therapy management and the importance of physiotherapy is that we can help the patient to live independently and be ambulant for as long as possible and to utilize full potential. Okay, and we can also prevent the complications like early contracture development, the decrease in ventilatory capacity. Okay, so by preventing this complication, we can utilize the full potential of the child, and so that child or a patient, myopathic patient, can remain ambulant and independent for as long as possible. Okay, and we can all, then by that we improve his quality of life. So the management goals are preventive therapy and supportive therapy. Starting with the preventive therapy, the first goal is prevention of respiratory illness. Now, death in myopathic cases mostly occurs because of respiratory failure. So, the first goal will be prevention of respiratory illness, and the purpose is to maintain the respiratory capacity as long as possible. So, for that, daily breathing exercise should be incorporated. Breathing exercises are often overlooked by the physiotherapist, but daily breathing, especially the diaphragmatic breathing, deep breathing, should be taught to the patient, and it should be practiced daily. You can also give incentive spirometer. Incentive spirometer provides a visual feedback, so it is very useful in case of children. Then swimming. Okay, swimming and games which require long and controlled expiration. So games like blowing bubbles, okay, or blowing candles. Which require long and controlled expiration, and swimming, they can be utilized. Swimming and hydrotherapy also has many other benefits, like they provide assistance to movement, and so the patient who has weak muscle can do full range of movement inside the water. Okay, so and it also provides relaxation. So swimming also has some other benefit along with a benefit on respiration. Then instructions in methods of postural drainage, chest percussion and assisted coughing is given to the parents. Now in a late stage, when the respiratory capacity is reduced and there is collection of fluid inside the lung, then that fluid has to be removed through postural drainage, chest percussion and assisted coughing. The patient's cough may not be strong enough to clear the secretions, and so you need assisted coughing, and it is not enough that this postural drainage and chest percussions are done once in OPD. They should be taught to the patient, and it should be done whenever needed. Whenever the parent feels that there is cough inside the chest, they should be able to give position to the patient and should be able to assist the patient in coughing. In later stage, the child may need routine daily postural drainage. So, a portable suction apparatus and a portable IPPB apparatus should be available at home. They may be rented or they may be purchased. But in later stage, the child may be dependent upon this apparatus. IPPB is intermittent positive pressure breathing apparatus. Second aim is prevention of soft tissue contractures and deformity. So for that, of course, the daily stretching of the muscles which are prone to get tight, and they are calf muscles, hamstring, okay, the bicep in upper limb muscles. So because these are mostly multi-joint muscles or two-joint muscles, and they develop tightness easily. So the stretching is required, daily stretching for five repetition for each muscle, and hold with 30 seconds is needed. But apart from that, activities which encourage the fullest range of movement possible, okay, for both upper limb and lower limb. So play activities that require the upper limb and lower limb to move in full range of motion. So that has to be incorporated in management plan. Activities like throwing a ball from overhead, throwing a ball as far as possible, so the patient will be required to hold the ball hold the ball with two hands, take both the hands overhead and throw it with full force. Okay, so that requires a full range of motion in shoulder flexion. Similarly, running up and down the hill, a small hill or a slope, okay, that requires full range of motion at ankle. So similar play activities can be thought of and incorporated in patient's management plan. Movement involving active contraction of the muscles antagonist to the short soft tissue. So if the muscles are tight, say for example calf and hamstring, then you need to design activity which will oppose this tightness. Okay, like I said, climbing up the slope. So children often they enjoy climbing up and down the slope. So you can incorporate that. So that will stretch the tight calf muscle and it will strengthen the opposite side, that is the dorsiflex muscles. Okay. Calf stretching should be started at the earliest. Calf will also, in addition to the tightness, it will also develop pseudo hypertrophy. You may also advise night splints and self-stretching. Night splints may be advised in later stage when the tightness is started to develop, but if you prevent the tightness from developing by giving activities at the earlier stages, then you may not need night splint. But otherwise, night splints may be recommended, and also self-stretching is taught to the patient, or you can teach the stretching to the parents. Prevention of immobility and inactivity, both physical and mental. Okay. Now, these child who are weak, they have weak lower limb muscles, they have history of frequent falls, they have difficulty in getting up from the floor. So it is expected that the parents might become overprotective about the child and will not allow the child to play or to run or to take part in any physical activity because they fear fall and injury. Okay. So that is very natural, but as a physiotherapist, you need to assure the patient, the parents that the regular physical activity will go a great way in preventing the complications of contracture formation. Okay, and it will help the child to maintain his aerobic capacity, maintain muscle strength, and so the child will be able to continue ambulation and independence for a long period of time. So you need to emphasize the importance of regular physical activity to the parents. Okay. So activities like swimming and games in the pool, sand hill climbing. Now climbing of a slope that is made up of sand. Okay. So it is a type of resisted exercise for the lower limb muscle. Walking in the sand. Okay. Climbing a hill of sand. This is a form of resistive exercises for the lower limb. Then activities with assistance or resistance of a pulley system or with small weights. So you can utilize, if the muscles are very weak, you can utilize the suspension frame and apparatus to provide them assistance, or you can utilize pulley system to provide assistance. And if the muscles are grade 3 or above, you can utilize them for resistance. For small finger joint muscles, tying knots that keeps the finger dexterous. So fine motor activities like tying knots can be utilized. Video games help developing competitive skills. Okay, remember, if the patient has BMP, he might also have cognitive problems and lower IQ. So you also need some mental activities which will help him focus and mentally active. So video games might be used to help. Then wheelchair sports. If the patient is wheelchair bound and in the late stage of the disease, then wheelchair sports can be encouraged. Orthosis. The role of orthosis is extremely important to make the child ambulant and active in later stage of the disease, when the child is very weak and the cost of walking is exhausted. Also this orthosis helps in preventing the fall. So provision of long length calipers when the child starts falling a lot. Criteria for bracing are the inability to walk for more than 1 hour a day with external support, and sometimes the child may have a fixed or rigid plantar flexion contracture. So in that case, percutaneous stenotomy of tendoachilles may be opted so that the range of ankle is improved and orthosis can be fitted. A parapodium type device or a swivel walker that requires less energy to walk can be used. Once the effort to stand becomes too much, even with orthosis, a wheelchair will be prescribed, and wheelchair will increase the child's mobility. So depending upon the strength of the child, the wheelchair may be prescribed. It could be a manual wheelchair if upper limb are strong, or it could be a powered wheelchair. Addition to the wheelchair may include a desktop, a special seat, a swing away elevated leg rest to allow the legs to be elevated, and a spinal support may also prevent development of severe scoliosis. So these are the additions that may be needed for a wheelchair. Now coming to the supportive treatment for parents. Now, it is never easy for parents to know the prognosis of myopathy. Okay, so establish a good relationship. Since physiotherapist will be seen daily by the parents and child, physical therapist has a good bonding with the parents, and it is that bonding should be utilized for educating both the parent and the patient. Social and economical problems may be referred by a therapist to the social worker. Emotional problems may need to be talked out. So emotional problems of the patient might be dealing with anxiety related to the prognosis of the disease. Okay, so that has to be talked and taken care of. Home visits may be made at intervals to see whether the modifications are required at home or not, or whether the home treatment program is carried out as per prescribed or not, and guidance about the child's diet. Now these children are prone to develop obesity, okay, because they are less physically active than the other children of their age. So they are prone to develop obesity. So that is why these parents, they need a guidance about the child's diet. And you may also refer the parents to a nutritionist or a dietitian for the same. Supportive treatment for the child. Child needs encouragement. Okay, so it is very difficult for a small child to undergo regular physical therapy where he has to do exercise and put in a lot of effort. So he needs constant encouragement, and even when he attempts or when he accomplishes a small set of exercise, he may be positively reinforced, okay, or he may need positive feedback. Assistance and resistance are graded. Both assistance and resistance should be graded. Specially, care should be taken not to give vigorous strengthening, because that vigorous strengthening may further damage the muscle fibers and it can aggravate the disease progression. Okay, so you have to be very careful when you give resisted exercise. It should be graded and not too exhaustive for the child. Demonstrate him what to do, so that the child does not have anxiety or fear of whether he will be able to perform or what is asked from him to be done. Okay, so demonstrate him what is to be done, and if possible incorporate activities that require that are play like. Discuss the child's condition with his school teacher. Okay, so that the child is exempted from some activities that are not suitable for him. Okay, and the school teacher will take care of that. The child should not be overprotected and should be allowed to do physical activity that is possible for him to do. Okay, and he should never be discouraged from taking part in the physical activity or mental activities. Encouraged to continue their education. So make all the efforts possible to enable the child to continue his education. It may need talking with the principal or school teacher, so that the class of the child is not on first floor or second floor where he has to climb stairs, and it may need the school to allow one of the parent to drop the child to the classroom and pick him up from there, which many schools don't allow. So you have to sort this type of problems about the child with the school principal or the school teacher, and so that he may be able to continue his education for as long as possible. Thank you very much for your attention.